Welcome back to the Morning Blend. When you think of a healthy heart and a good lifestyle, there are a couple of things that come to mind. Healthy eating, of course, and exercise. So why do we have a dental hygienist on our show? It's because your teeth and your mouth are an important part of heart health also.
That's true. Stacy Haddock is with WisconsinSmiles. She's got some important information about how your oral health is connected to your overall health. Good to see you again.
It definitely is. Nice to see you again, too.
Yeah. You know, it's funny. We hear this more and more that dentists can tell so much about your health just by looking in your mouth.
Definitely.
And heart health is one of the main things you can detect and see. What are you looking for to correlate with heart health?
So when we look in your mouth, we're looking to see how your gum tissue is. So if your gum tissue is red, inflamed, they bleed when you brush, when we touch them, if they're a little tender when you brush, then you have gum disease.
Wow.
Is it reversible?
If it's just at the surface of the gum level, it will be reversible just by brushing and flossing. Now, if it gets underneath the gum line where it starts to affect the bone and cause infection in the bone, then it's not reversible. Then at that point, we would have to help you out with that and maintain it.
Okay.
What are some of the other symptoms of gum disease? You know, and I think a lot of times when people have those signs, you know, they bleed when they brush or whatnot, they're afraid to go to the dentist because they feel bad. Like you don't want to like show what's going on. But that's when you really need to make the appointment.
Right. So when you come in, what we do is we look at your gum tissue, but then we also measure from your gums to your bone level. And what we want to find with healthy gum tissue would be it's kind of hard to explain because
people are used to those numbers.
Measurements, right?
Yeah,
the measurements.
1, 2,
right.
3.
So when you hear 1, 2s, and 3s, that's a healthy mouth. It doesn't. If you start to see 4s, 5s, 6s, that's when you start to have the infection in the bone, and that bone starts to slowly go away.
Gotcha.
And that's where you have that deterioration. It's a problem. So what are things that we can do to help? So a lot of people are going to think of flossing daily, which I'm sure that helps a lot. Certainly brushing your teeth regularly, probably after meals, at least twice a day. Are there other things we can be doing?
So brushing twice a day, definitely. Making sure you're flossing daily. You can use an antiseptic rinse like Listerine or Crest Pro Health after brushing and flossing. By keeping that bacteria count low in your mouth or around the gum line will help keep that infection away. It also helps keep the infection away from your whole entire body. That infection, all your gums have little blood vessels in it. So when that inflammation starts to form, the bacteria in your mouth will go into that bloodstream and cause inflammation with the vessels in your heart.
Okay, that's how it affects heart health.
Yeah, so the arteries in your heart will start to get the inflammation as well.
Look how close it is to your heart, you know?
And that blood flow will start to slow down going to the heart. So that will cause heart disease and definitely heart attacks.
Wow. I mean, just from your mouth, you think about that, how important it is then to get those checkups. And this is one of the reasons you guys are offering a free screening is because you really just want this no judgment zone. Like, hey, come on in, let us help screen.
We definitely are. So we want to help you make sure you don't have the risk of having heart disease. So when you come in, we'll take a look. We'll look at your gums, we'll do the measuring, we'll take some pictures and just show you exactly what's going on in your mouth.
Yeah. I think that's important.
And I think it's great that that you offer these free oral health screenings because, you know, as Tiffany mentioned, a lot of people are afraid to go to the dentist. I think anything you can do, especially if it's been a little while since someone's been to the dentist, to sort of incentivize them or encourage them to have that visit. Once you get started, then you can get in a regular routine again.
Definitely. And this visit is really easy. So all you do is come in, we use a camera, and that's it. We take pictures, we show you what's going on, and it's just nice and relaxing for that visit. So that kind of eases you back into going to the dentist.
Yeah, a good status update too and see how your oral health is.
Yeah, exactly.
And can a dentist looking, you know, we talked about them being able to detect problems in the heart by looking in the mouth. Can they do it just by sight? Someone opens their mouth and they can tell if there's a problem?
Yes. You can do it by sight, you can do it by smell.
Yeah, all the things.
Yeah, all the things, anything, yeah.
What if they're like, but I just had a bunch of coffee and lunch? I know, but.
I'd like to also mention too, it is almost the end of the year. So people with dental insurance, take advantage of it. You're paying for it. You don't want to, it doesn't roll over, so you want to take advantage of it. Get in now, because towards the end of the year, we get so many calls in December saying, oh, I need to use my insurance. At that point, we're really, really busy.
Yeah.
So get in now. We'll start you with your evaluation, and then move from there and getting things done and utilizing your insurance, because you pay a lot of money for that.
There you go. That's your reminder. So give a call to Wisconsin Smiles. You can do that with the number on your screen, or take advantage of the free oral health screening. Again, it's just a camera, nothing intimidating. They're really just going to help you and let you know if you may be at risk for heart disease. It's a value of $125. So take advantage. 414-982-3676 or WisconsinSmiles.com. Thanks so much, Stacy.
Thank you.
Great to see you. Thank you so much for your time.